If you analyze the long-term data of DES, you can see clearly that there is reduces a benefit over the time when you implant a second generation DES. And what is worrisome is that there's no plateau in the incidence of these events over time. So we have analyzed over 20,000 patients that uses DC second generation DES, and the risk of having a late ischemic events over the period of 5 years is around 2 to 2.7%. So I think the use of DCB in this scenario is really useful. To my point of view, DCB constitutes a safe and effective treatment option to solve complex clinical and anatomical scenarios in a variety population of patients. DCB use are really useful in patients with multivessel disease or patients with a diffuse coronary disease, on where you want to reduce the number of stents or the length of metallic scaffold that you're going to implant to the patients. But also the use of DCB is really useful in patients with CTOs, complex lesions like bifurcations, patients with aneurysms or ectasias, or patients with a complicated and difficult clinical profile as patients with high bleeding risk, on where DAP compliance is an issue in these patients. But also in patients, the really young population of patients that is coming to the cath lab every single day with really aggressive expression of coronary artery disease and really early expression of coronary artery disease. One important thing is that the number and the length of stents matter, because they are both recognized as independent predictors for in-stent restenosis, stent thrombosis, and late clinical ischemic events at follow-up. Well, device choice is important because there is no class effect in DCBs. So you need to pick the right device, the device that has proven benefits for a large population of patients and has a lot of scientific background behind it. The SeQuent New is one of the best devices in the market, has more than 20,000 patients included in clinical trials, more than 35 clinical trials conducted. It's a device that has proven the effectiveness in different clinical scenarios, treating patients with coronary artery disease, but also it's a really safe device. So picking the right device is something fundamental to provide the best long-term outcomes for our patients. DCB and stents are complementary devices and not the opposite. So every single interventional cardiology should be used both jointly in the daily practice at the cath lab. The modern toolbox that we need to treat patients or the patients that we are having at the cath lab every day, I would say it's really complex. It have to be implemented with different devices. So you can use DCB-only PCI strategy, or you can use more a modern approach that we call the hybrid PCI, which is a combination of DES, the latest generation of DES, the second generation, and DCBs. So this is a really important aspect because you have to try to reduce the number of stents, the length of stent, and try to pick a DCB that have proven benefits for the population. Well, in the future, and I think the future is really close, the way of thinking and the way of we are going to treat patients, mainly young population of patients, I think it's going to be the opposite. I think we're going to try to use first as a first approach a DCB, trying to avoid implanting a metallic scaffold in the coronary arteries. The aim of our treatment is to provide the better outcome for our patients. Have to be a combination of DCBs, in some cases DCBs and DES, but also optimal medical treatment in all our patients. So the current generation of DCB are way better than the first generations of DCBs. So this has been proven that when you treat a patient with a DCB strategy, it doesn't matter that if a hybrid approach or DCB PCI only, the long-term outcomes benefits are there for the patients. We know that there is no class effect on these devices, so every single devices have to be tested in a proper manner. But the positive results that we have already with a broad population of patients that we have treated with DCB, the data is reassuring. So I think DCB is gonna improve over time, and the long-term benefit and the result are gonna be even better in the years to come.